Hi, my name is Amising Cabiles from BSCS2B, and the bioethical issue that I will be talking about is euthanasia. So, what is euthanasia? Euthanasia is the practice of ending a life to eliminate pain and suffering. Different countries have different euthanasia laws, but this practice is considered illegal in most countries. It was practiced in ancient Greece and Rome and was supported by famous philosophers such as Socrates and Plato. Categories of euthanasia. Euthanasia has three different categories, namely voluntary, involuntary, and involuntary euthanasia. Voluntary euthanasia is when a person or patient consents to have their lives ended. This type of euthanasia is legal in a number of countries. Non-voluntary euthanasia is when a person or patient cannot consent. This type comes in active and passive forms and is considered legal in certain conditions. Involuntary euthanasia is when a person or patient's life is ended without consent of the patient's will or family. This is usually considered murder and illegal in most countries. Forms of euthanasia. Passive euthanasia is the most well-known form of euthanasia, which is commonly referred to as pulling the plug. It is the process of limiting life sustainment treatments so that the patient passes much quicker. This practice is legal in some circumstances in many countries. Active euthanasia, on the other hand, is legal in only a handful of countries, and it's limited only to specific circumstances, such as administering legal injections. Euthanasia is legal in Belgium, Canada, Colombia, Ecuador, Luxembourg, the Netherlands, New Zealand, Portugal, Spain, and Australia. Euthanasia eligibility varies among jurisdictions, with some allowing euthanasia for mental illness. Here are two real life examples of euthanasia. Aurelia Brouwers from the Netherlands. The 29-year-old woman became eligible for euthanasia under the country's 2002 Termination of Life on Request and Assisted Suicide Act. She didn't suffer from physical illness, but rather psychiatric problems. Others say that she would die regardless and that the option to get euthanized is her right. However, many also say that it has gone too far and that being able to have an organized death is bad for society as it undermines our ability to deal with suffering. Marta Sepulveda Campo from Colombia. The 51-year-old woman suffering from ALS or amyotrophic lateral sclerosis was allowed to be euthanized, which will allow her to rest from her painful illness. She was happy in the days leading up to her death with her family who supported her decision to escape her pain. However, a day before her supposed death, the Instituto Colombiano del Dolor or Colombia Pain Institute denied her. On July 22, the Colombian Constitutional Court extended the right to the procedure for patients that suffer from intense physical or mental suffering. The Pulveda asked for a permit days later, which was granted on August 6. Conclusion. The topic of euthanasia is extremely sensitive and complicated. It may reduce excruciating pain, but it also brings up serious moral, ethical, and legal issues. Different countries are still figuring out if it's a personal right or something that should be considered illegal. With medical technology constantly evolving, discussions such as euthanasia will become more relevant. In the end, euthanasia is a bioethical issue that makes us think about the value of our lives and our rights to our bodies. Thank you for watching, and these are my reference for this topic.